Okay, let's go ahead and get started. Good morning, everyone. Thank you for joining us this morning. I know it is kind of off schedule for our normal webinars, having it on a Friday. So I just want to say I appreciate everyone for taking the time out of their busy schedules. I know everybody's getting ready for the AEP next week, and then obviously we have the OEP. So a lot of things going on. So again, just thank you for everyone for taking the time out of your day. It is a beautiful Friday, so hopefully we all can kick this off and start the weekend off right. We are super excited about all the opportunities this year. In the past few years, as most of you already know, we've been very limited on options in the ACA world on the under 65. So for those of you that were in it, years ago, there were lots of opportunities, lots of carriers paying high commissions. Everything was great, and then they kind of just went away, which obviously caused a lot of people to either change products that they were marketing or get out of the business altogether. So we are super excited to be able to bring back this opportunity. For those of you that haven't been able to sell because of not being able to get appointed or just haven't had really anything to offer, this is the opportunity. So we are joined today by Jeff Bonico and Jason Makito. They pretty much run the show over there for North and South Carolina and Tennessee for the Bright Health plans. They are the new ACA carrier coming into the Carolinas. They are going to be offering extremely competitive plans, rates, and high commissions. So for those of you that were looking for something to offer your under 65 people and to expand that market growth, this is the perfect time to jump on board. But before I turn it over to those guys, I want to go ahead and just mention some things real quick about Messer Financial. What you're seeing on your website right now, or on your screen, I should say, is our website, Messer Financial. Everything that you basically need for any of your products, really, for MA, life insurance, ACA, we have available on our site. But one thing I wanted to show in particular, for those of you that were on our webinar before, for our MyMFG tool that shows the ACA capabilities, that was a great webinar, and we are going to have full control over that, where you're going to be able to offer all the carriers, and you can quote, you can enroll. It's a super slick platform. And it does work as a CRM, so it keeps track of all of your business. Plus, you can do Medicare Advantage through there. So I want to say that one more time. On our MyMFG, our proprietary enrollment platform, you can do both Medicare Advantage and ACA through that platform telephonically. So as technology grows, the opportunities on how we sell, what we sell, also continue to grow. So if you would like more information on that, please feel free to contact us directly. And we'll go over the contact at the very end. Also, you should see on your screen where there's a part that says we're going to hold off all questions till the very end. Everybody is in silent mode, so if you do have questions, just type it on the little question message bar, and we'll answer all of those at the very end, because we do have a lot to go over. Also, wanted to point out one thing for all of you that like to qualify for trips. This ACA product is going to be the perfect thing to get you to qualify. If you've ever been on a carrier trip before, keep in mind that those are based off of that year's production, and then based off of that, then you qualify or you do not qualify for a trip. With Messer Financial, for example, we have our Top Producer Summit every year that we have in Concord, North Carolina, where we take all of our top producers from around the country. We fly them in. It's a great event. We have all the carriers there. They talk about what they have coming up for the following year. We have events. We do golf. We do all kinds of different fun things. We have a NASCAR tour. We did botanical gardens. And this is all complimentary, and we take care of everything. So it is a wonderful trip. The brainstorming, the conversations that you're going to have with other top producers from around the country and sharing their ideas on how they market is, to me, priceless, because it really does take your business to the next stage. And the only thing that you need to do to qualify for that is you got to have 200 members on the books. So once you hit that 200 members, you qualify year after year. Keep that in mind. It's not based off of that year's production. It's just your total book of business. So once you hit 200 members, that's Medicare or ACA, you qualify for this trip year after year, as long as it does not drop below 200. So that's distinct to Messer Financial, and it kind of separates us from anything else. Plus, we have other trips that you can qualify for, etc. So again, we want to partner with you. We want to share all the great information with you. And we think that this is a huge opportunity that we want everybody to take advantage of, okay? So if you're on this, it's probably because you received some kind of advertisement saying that they're coming into your area, and that is true. They're going to go over all the areas that they are, what the benefits are, how to enroll them, how they can make payments, just about everything that you need to know. So with that, again, I want to thank everybody, and we'll answer all questions at the very end. And with that, I'm going to turn this over to Jason Makito and Jeff Bonico. Jason, go ahead, buddy.
As Micah was saying, we do have a lot to go over in a relatively short period of time. So I will try to get to the end and save a couple of minutes to be able to answer questions, because we do have quite a bit of content in here to cover over the next 40 minutes or so. So again, appreciate everybody's time and taking the time out of your Friday morning to be able to join us to learn more about Bright Health. I think one of the biggest questions that's going to come up for a lot of folks is who Bright Health is, where Bright Health has come from, and where Bright Health will be for clients coming up in 2020. So we'll try to address those. We'll try to talk about some of the plan designs and some of the unique nuances on the plans that will exist for North Carolina for this coming year, and show you where Bright Health will be as well. So you'll have a pretty good overview after we finish this today of Bright Health overall. So thank you again for the time, and let's jump in. So just as a quick glance here, we do like to talk about this because a lot of folks do not know who Bright Health is or where they've come from. To this point, Bright Health's received about $440 million in privatized funding from two of the largest venture capitalist firms in the country, NEA and Bessemer. So have a lot of faith that there's a lot of private dollars behind Bright Health. A lot of folks that like what Bright Health is doing, like the direction that Bright Health is heading. So they're putting a lot of their dollars behind us in order to help us be successful in getting this product to grow for the individual and family plans and for Medicare and for other products that we're looking into in multiple states down the line. At this point, I want to just sort of talk about some of the leadership that we have in place because we're very proud of that. We do have quite a few folks at the top levels of our leadership that actually come from United Healthcare, but I do like to point out that we have no affiliation with United Healthcare whatsoever. The CEO for Bright Health is a former CEO for United Healthcare named Bob Sheehy. And one of the other new gentlemen that joined us is Mike Meekin. He joined us as well, coming from the Optum unit of United Healthcare. But again, we have no affiliation with United. But in terms of the leadership that's in place, know that we've got strong leaders around the organization that are helping guide the ship with some very intelligent folks that know what they're doing. They don't all come from insurance background. Some of them come from the consumer side as well. So just kind of keep that in mind as we grow as a company and some of the products that we put into the marketplace and we try to differentiate ourselves, you'll kind of understand why based on the leadership that we've got in place. So coming from a little brief history in terms of Bright Health, I know this is a busy slide here, but we'll go over sort of where we've come from just in the last 4 years. Bright Health essentially started off in Colorado. Colorado is a state-based exchange, and in that first year, they got over 10,000 members that first year. And the model is very simple that Bob Sheehy wanted to use. It is get into a marketplace, find a very strong network, find a strong care partner in that market, and then align yourself with that care partner, a care partner that wants to partner with you. Try to drive down and get the best rate that you possibly can from that care partner, because that care partner benefits by all of the members that Bright Health gets are all using that same care partner in that market. And then at that point, you'll be able to drive cost and drive containment for that membership and help those members have a better high-level coordinated care through that one partner. So that's the model that it started with, and that's the model that is rolled out and proven to work in other geographies where Bright Health has expanded to. So it started as the vintage market in Colorado, but then expanded over into Tennessee, down into Alabama, down into Arizona, and then additional Medicare Advantage products over in some other states like Illinois, Ohio, New York also. But 2020 is really the benchmark year for Bright Health in terms of where we're going. If you take a look at the new markets that Bright Health will be entering in, there's significant population reach that is going to be we're going to try to obtain by the markets that we're jumping into for 2020. You're talking about places like North Carolina, which just in that footprint alone has 130,000 members on the exchange that will have access to get Bright Health for 2020. And then you've got Florida, which is a totally separate animal, where there's, I think the last I saw, and it may be more at this point, there was about 700,000 people on the exchange in Florida. So some of the geographies that Bright Health is entering, in addition to the entire state of Nebraska, Oklahoma City, you're going to see that Bright Health is really positioned in a good place to be able to pick up a significant amount of new membership for 2020. And that's only going to help us fuel our growth as we get into 2021, 2022, and further years. So the model that we provide to the member, it is different because the models that we provide, we want the members to stay within the network, within that care partner's footprint. So it becomes more efficient for the member because they're not going to all kinds of different provider systems out there and having to then coordinate if testing was done at one provider system, the other provider system where they're having another test done. It takes time to reconcile that to make sure that the care is coordinated as best as possible. So it becomes a little bit more of a seamless approach. So you do get the benefit from having a reduced amount of testing, saving money, et cetera. And by being able to work with that member within that one health system, and Bright Health has all that information on that member. So you're able to realize that better coordinated care for that particular member. So that model is different. It's different specifically in North Carolina. When I get into it and I talk about it a little bit more, a lot of people are familiar in North Carolina with the Blue Value plans and the Blue Local plans, using Atrium or using Novant or using Wake Forest Baptist or Rex, Wake Med, et cetera. It's different for different counties across the state. This model is going to be very simplified because in all the counties where Bright Health is selling a plan, it's going to be the same plan. It's going to be the same plan. It's going to be the same care partner. So whether you're in Winston-Salem or whether you're in Charlotte, you're going to be seeing those same providers within that care network. So again, the approach just comes from, if you take a look at some of the partners that Bright Health has used over the last few years, I think Tenet is very well known nationally for a lot of the reach that they have. We're partnered with them in multiple markets. And what we try to do when we put these plans together is ultimately, when you're talking about ACA plans, you've got to try to get the lowest price possible, because 80% of the members that buy ACA plans are buying based on price alone. And if you can't achieve a low price point with that care partner and with that plan design that you put together, you're almost wasting your time, in my opinion, because people aren't going to funnel down to the second or third page on healthcare.gov to find another option. You've got to be first and foremost on that front page of healthcare.gov. So you'll see some of the plan designs as we jump into those, some of the 2020 plan names. We want to keep it a little bit simple. So for North Carolina, you'll see the Bronze Premier, the Bronze HSA. You'll see the Silver 1, the Silver 2, the Silver 3. And then if you're in the Winston-Salem market, it says Silver 4, Silver 5, Silver 6. They're all the same plans, just different numbers on them based on the geography where they're located. So you see one simple HSA plan that we'll jump into and show you, one Bronze Premier plan. Obviously, with the name Premier, you're going to assume it has a little bit of a rich level of benefits, and that's going to be the case for that Premier plan, and we'll show you what that looks like in a minute. Overall, if you look nationally, in terms of the market that Bright is getting into, as I mentioned before, just with Florida alone, the massive reach to Florida and the massive number of members that have exchange plans down there. So all of these markets have one common feature, which is the fact that these are strong partners that we've built relationships with, and there's a lot of potential members that we can get from those markets. And then in addition to that, in a lot of geographies, you have a highly engaged broker channel that's out there. You have a lot of agents that are sort of sitting on the sidelines, in my opinion, in some states that just have decided that they did not, Micah mentioned this earlier, they didn't have something to sell, or maybe the commissions weren't worth their time to sell it. I hope that with the products that we're bringing in North Carolina and with the commissions that we're going to pay, that we'll be able to bring some of those folks off the sidelines for 2020. So if you are selling in different markets, this kind of gives you an idea of who those care partners are in those geographies. So you'll be able to see that from this slide here. This webinar today is going to focus heavily on North Carolina with a little bit of South Carolina flavor. But if you are doing business down in Florida, which is a massive market again, you'll see who some of those care partners are listed on here.
Yeah, well, and I'd like to mention, when we get into the product details, A member with Bright Health can maneuver between systems. So if we have a care partner in Colorado and your client happens to end up in Colorado, they will be treated as in network if they fall in one of our care partners, depending on where they are. So just to emphasize that you can visit other care partner networks throughout the country and stay in network.
So with North Carolina specifically, if you look at the 10 counties where Bright Health will be for 2020, there's about 130,000 lives that have products through the exchange, and that is just through the exchange. There's obviously a lot of other members that buy individual health plans not through the exchange. They buy them directly from the carriers or through brokers directly. Then they're not going through the federal marketplace. So I don't know exactly what that number is, but just on the exchange, there's 130,000 lives that are on the exchange from Charlotte up through Winston-Salem in those 10 counties. And again, in that entire footprint, it's going to be 100% Novant Health. However, Novant Health has a clinically integrated network, which at this point, they are partnered with 32 independent practices that are out there. So 2 examples that I share with folks, one is Ortho Carolina, and the other is Charlotte Eye, Ear, Nose, and Throat. Both of those providers are within the clinically integrated network for Novant Health. So just keep in mind that while they don't have the Novant logo on their door, they are part of that particular network. Novant Health is a broader, in looking in a broader terms, if you look at some of the care partners that Bright Health has across the country, Novant Health may be one of the largest that we have, just because of in terms of their size, the number of hospitals that they have, the access that they have through primary care physicians and specialists. Those are significant numbers. So when I hear people talk about skinny networks or narrowed down networks, you cannot say that about the product that Bright has with Novant Health. When you have 550 plus primary care physicians and 1,200 plus specialists, you can't say that this is a skinny network. This is a network that is known across the state by thousands of folks. Many of us have probably used their facilities in the past, and I can say personally that I've used it for myself, for my wife, for my 3 children that we've had all at Novant Health. They provide outstanding care, and it's great that we're able to get this relationship started with them in North Carolina. And what I assume from this is that this is just the start for Bright Health in North Carolina with these 10 counties. And as we look into the future, into 2021, whether it's expanding with Novant Health or building new care partnerships in other parts of the state for 2021 into 2022, we will always have that relationship in place with Novant, since we are exclusive to using them. From a pharmacy perspective, the pharmacy benefit manager that Bright uses is EnvisionRx. There's 2,000 plus statewide pharmacies. There's 65,000 plus national pharmacies. Walmart, CVS, Walgreens, Publix, Rite Aid, Sam's, or all have access to using EnvisionRx. So the short story is, as well as a bunch of independent pharmacies, the short story with that is pretty simple, is the fact that members shouldn't have difficulty finding a local in-network pharmacy to be able to get their prescriptions at. So we want to provide ease of access, and I think we do that by using EnvisionRx. Plan summaries for North Carolina. Again, I mentioned this earlier, that when you build these ACA plans, you want to be able to try to build the lowest price bronze. Ideally, you'd like to have the lowest silver and the second lowest silver. If you get the third lowest silver, that's great too. But you want to build the lowest price plans that you can. But having said that, you also want to build plans that have value for the member and have value for the provider system. So we were very thoughtful in terms of the plan designs that we did, and I'll show you a little bit more detail in terms of what that means. But just for North Carolina, there's going to be 8 plans in total. The only gold plan is going to be on exchange. The silver, the bronze, and the catastrophic will be on and off exchange. So just the gold is on, silver, bronze, catastrophic, on and off. 95% of the market has either a silver or a bronze plan. So those are going to be the types of plans that you want to focus on the most. Copay ranges you'll see on our plans, they'll range anywhere from $25 on a PCP to $40. Obviously, those are just for the standard plans. If you look at some of the cost share reduction plans, those PCP copays will be usually on average around $5, $10 as an example. And then specialist plans, you'll see $50 to $80. And we'll jump into those plans so you can see at a better glance what those look like. Won't focus too heavily on the gold plans. The gold 1 and the gold 2, they're exactly the same plans. Silver 1 and silver 4, exactly the same plans. They're just differentiated because of where the plans are located geographically. So in that Winston-Salem area, anywhere from Davidson County, Forsyth, Yadkin, Stokes, those are going to be the plans that are gold 1, silver 2, silver 3, and then the Charlotte plans below that. But again, just keep in mind that those are the exact same plans. So going from left to right, silver 1, 2, 3, the lowest price silver plan is going to be silver 1 and silver 4, and then the middle price silver plan 2 and 5, and then the higher price silver plan silver 3 and 6. Silver 3 and 6, it was built for a lot of members that want to purchase silver plans but also want to have a specialist copay. So they do include a plan with a PCP copay of 25 and a specialist copay of 80 on that plan. And if I could tell you just for a moment about the variations on some of these plans, 60% of the members do have cost share reduction plans. So either that 73, 87, or 94% plan. At the silver 1 and the silver 4 level, the 87% plan that Bright Health has will have a $500 deductible on the exchange. The 94% plan that Bright Health has will have a 0 deductible on the exchange. The silver 2 and the silver 5 plan, those will both at the 87 and 94% levels, those will both have $0 deductibles on them. And then the silver 3 and the silver 6 plan, one is going to have a $400 deductible and the other is going to have a $1,000 deductible. So if you talk about 6 potential variation plans from the silver plan set that we have in North Carolina, 4 of those 6 variations with Bright Health are going to show 0 deductible. And at the 94% level, which many folks qualify for in North Carolina, you'll see the out-of-pocket range will be in those variations from $800 to $1,000. So we really strive to build lower cost plans but provide better value for the member by having those 0 deductible plans that they will find on the marketplace. So I think that's going to be a really nice advantage that we're going to have for North Carolina. A lot of folks, obviously, they look at premium first, but then if they look also that the plan is a 0 deductible plan with $1,000 out of pocket, I think that could be very appealing to a lot of folks in North Carolina. I think that's going to grab a lot of consumers' attention for North Carolina. And those will be different than what our only competitor will show on the marketplace in North Carolina too. Those will look different than the Blue Cross plans that are out there. At the bronze level, ideally, I said earlier that you want to have the lowest priced bronze plan. So with the bronze 1 and 2, that's going to be an $81.50 individual deductible plan with 100% coinsurance. The primary care copay still will be included on that with $40 for your first 3 visits. I think it's pretty easy to build a really low cost bronze plan that has an $8,000 deductible 100%, but it doesn't have any PCP copays. When we did our research and we talked to some of the brokers that were out there, and obviously we talked to Novant Health in terms of when we built these plans, we think it was a little bit better move to try to build a bronze plan at the lowest price point that we can that still included some value for the member in terms of a primary care copay. So when I looked at some of the plans that exist today for 2019 on the exchange from our competitor, what I saw is that they do not have a primary care copay at their lowest cost bronze. Whether or not they sell a lot of that is one thing, but just knowing that our lowest price bronze plan is still going to include at least 3 visits with a $40 copay, I think is going to separate us from the lowest cost bronze plan that our competitors have in the marketplace. Then we built the premier plans because people want to have, there's a lot of folks out there that do say, actually, I don't want the lowest price plan. I want something that has a little bit more bells and whistles on it. So we did build that plan with a lower deductible in mind at $5,000 with $8,150 out of pocket, with a $25 unlimited copay, and then $75 urgent care copay. So if you kind of take a look at the plan designs that we've put out there, it does tend to focus very heavily on some of the common things that people use. Generic prescriptions, primary care physician, and urgent care. I come from most recently working at working at Aetna on the group side. And I cannot tell you how many groups I saw that have those Blue Cross 1, 2, 3 plans that only include a primary physician copay, an urgent care copay, and then a generic prescription copay. So there are thousands of folks across the state on the group side that have those types of plans. I don't see why there couldn't be a lot of other folks that would buy plans that would look very similar to that, as long as that particular plan meets their needs. In terms of HSAs, North Carolina, there's going to be one HSA. It's the bronze HSA with the 68, 50, 100% plan, and then at the catastrophic level, which a few members will be able to purchase, the 81, 50, 100%. On the HSA side, I will say that we are not partnered with any particular vendor. We do not endorse any particular vendor. If folks are using the financial instruments for an HSA, that member is free to use whomever they want to set up their account with to manage that HSA for them. And then with pediatric dental and vision, you're going to have that included for those under the age of 19. Your diagnostic and preventive services will be covered free of charge. And then when you get into some of your other services, those will be subject to deductible. And if they do not have a deductible on their plan, which I said many of the cost share plans that we built do not have deductibles, those are going to be 50%. One other point to mention about the dental side is that we do not have a dental network. There is no network that we use for dental. So the members are able to go to any dentist that they want to receive that benefit. They'll just have to send that bill in for us to reconcile it for them. And then we'll also include the vision benefit on there, which will include glasses and lenses, one per year, or a year's supply of contacts as well. So I want to get into some other details that are going to make us a little bit different from the competition. Actually, not a little bit different, going to make us a lot different than the competition out there. So we'll go over that here in just a second. But when after the members enroll with us, they're going to get an ID card in the mail, and they're going to be asked to set up their member hub. The member hub is done at brighthealthplan.com. After they get their ID card from us, keep in mind that on that ID card, it is going to have the Novant logo on there. So it just reinforces the fact to the member that whenever they get plans from Bright, they want to make sure that they stay using that care partner with Novant. They'll get their welcome packet and they'll get ongoing communications. Make sure members sign up to get some method of ongoing communications from us, whether it's electronic or through the mail. We want to be able to communicate regularly with these members because of the 3 additional benefits that we point out that they're going to have access to. So let's do a little overview, since there's some members on the line that do have South Carolina reach. The South Carolina market, it's 3 counties. It's Greenville, Anderson, and Pickens County in South Carolina. The partner down there is Southeast Health Partners. They were built essentially to provide plans for value-based care for members. So those Southeast Health Partners is an example. That's going to be Anderson Medical, Bon Secours St. Francis, Spartanburg Regional. Those hospitals are all under that headline for Southeast Health Partners. But again, the plans down there are the 3 counties, Greenville, Pickens, and Anderson County. So you've got 2 facilities, 2 hospitals with Anderson, with 35 clinics and 75 PCPs. And then for the Greenville area, we've got 2 additional hospitals with 70 PCPs and 190 specialists. So a lot of this is going to be, Bright Health tries to be a local based plan. This I think achieves that definition of being local, where we provide access to these facilities within these three particular counties. So if you do have members down there, I think we're going to be in a very, very competitive position for South Carolina. And I think the plans that we have down there are going to be equally attractive to members when they do see us on the exchange in South Carolina as well. It's the same pharmacy benefit manager for South Carolina and Vision RX. Statewide down there, there's about 1,100 pharmacy locations using the same pharmacy access that we have that I mentioned a minute ago for North Carolina. The strategy is the same. The strategy is the same from state to state to state. It is to build the lowest cost bronze plan, the lowest silver plan, and hopefully the second lowest silver plan as well, since the majority of members are in that bronze or that silver plan. So if you take a look at South Carolina, it is a little bit different than North Carolina. The gold plan is on exchange only, just like North Carolina. But in South Carolina, excuse me, there's an additional silver plan that is off exchange only. And then you've got 3 additional silver plans that are on exchange and off exchange, 3 bronze plans that are on exchange and off exchange. So the market focus says that 50% of the market actually qualifies for cost share reduction plans. So we would focus very heavily on those variances as well. So with the excuse me, with the bronze plans, you will see that one of the bronze plans does have PCP co-payments as well. So we'll take a look at that in just a second. But otherwise, the co-pay ranges are very similar. They're a little bit different for South Carolina because the ranges go up to $50 instead of $40. And some of the plan names are a little bit different as well because there's one Silver Direct, and that's the off-exchange plan for South Carolina. So if you look at the silver plans, the $4,700 deductible, the $4,000 and the $3,200 deductible, those vary a little bit different from North Carolina, but some of the benefits are still similar when you look at the primary copays on that, primary copays on those plans. And then you see the one plan that is silver that is off exchange only. That's going to target to the consumers that do not buy their plans on the exchange. And there's a lot of consumers, again, that just buy off exchange plans. So we built a very competitive off exchange silver plan with the $5,500 deductible that still includes primary care copays of $40 and specialist copays of $80. And then some of the same nuances that you saw in North Carolina in terms of copays on generic drugs. It all looks very similar. Emergency room subject to deductible looks very similar to North Carolina. The bronze level, the bronze 1 plan is exactly the same as North Carolina, $81.50, 100% plan with a $40 primary care copay. The bronze premier plan, which again was also offered in North Carolina, you'll see that that plan is on here. The difference is that this plan, the bronze premier plan, has a $25 primary care copay and a specialist copay of $80 on that plan. But the deductible is a little bit different from North Carolina. It's a $6,100 deductible in South Carolina. The North Carolina deductible was $5,000. And then the one HSA option is exactly the same for South Carolina as it is for North Carolina, the $68.50 100% plan. And then for the few members that can get catastrophic, a little bit of a different plan design down there, $81.50 with a $50 copay for your first 3 visits. And you'll see to the right how that kind of compares with what we're looking at in terms of the plans that exist down there today. So I know we're going to be in a good price point for South Carolina. So if you are doing any business in that market down there, you definitely want to take advantage of what we're offering. And I know as well, I can say that we are doing a rollout down there in South Carolina coming up next week to be able to meet folks in the Greenville market that want to come out and learn a little bit more about Bright Health for that geography. So I want to talk about 3 differences with Bright Health, 3 value adds that Bright Health has that you will not find with anybody else. In the individual healthcare space, as new carriers enter these markets, they're trying to build things that differentiate themselves from the carriers that are on the ground today. Okay, so one of the ways that we're trying to do that is provide these 3 value adds, would kind of have a little bit of a Medicare Advantage spin to them in terms of what they provide for the member. And we think that folks are really going to like these. But just keep in mind, the only way they're going to know about these rides, meals, and cash rewards before they're a member with Bright is if you tell them about it. Because it's not going to be on an SBC, it's not going to be on a plan summary, it's not going to be on a COC. You're going to have to be the ones that educate them. If they have a feeling that Bright Health is right for them, you're going to want to make sure that you mention these 3 value adds that Bright Health is going to provide them as well. So rides, meals, and rewards. Rides to and from appointments. You can get up to 4 rides to and from the doctor through the Care Partner circulation. They also contract with drivers like who are partnered and contracted with Lyft. They have the ability to bring up to 2 guests with them, and they have the ability to request one of their prior drivers. So if somebody does not have the ability to get to their primary care physician appointment or their specialist appointment or to the hospital for a service, we can set that up through member services to have somebody come out and get them to give them a ride to the facility. Okay, they could bring guests with them if they have special needs, that if they have certain mobility issues that they're not able to go in a normal vehicle. If they need some sort of specialized vehicle, we can find a specialized vehicle to try to work with them also to get them to their appointments. So every single member will get 4 rides to and from their doctor through the Care Partner through this service that we're going to provide for them. We will also provide members with meals. So if somebody has an inpatient hospital stay, when they're released from the hospital, they're going to be able to take advantage of getting free meals sent to their home. So they're going to get 4 days of meals after they're released from the hospital. It doesn't automatically happen. You don't just automatically have meals sent to your home after you are released from the hospital. We'd want to coordinate that in advance and coordinated, especially if there's somebody who's going to have particular dietary restrictions after they're released from the hospital. But they'll get 4 days of meals for the entire family. So it's not just the person who received the care, it's actually everybody in that household. So if it's a situation where you've got a member who just had a baby delivered as a Bright member, everybody in that household for that mother who had that child is going to be able to get those meals sent to their home. I think that's a great benefit. That's a wonderful value add. I think it provides a lot of I think it shows a lot of comfort from the insurance company to say, hey, we understand that it's difficult for you after you get released from the hospital. The last thing you're thinking about is preparing those meals. So being able to offer this service to them, I think is going to be something that people are going to love. And then they'll also have the ability to earn cash. I think everybody loves a free meal that comes to their home, but I think what they love even more is cash. So they're going to get a Bright Health logoed Visa reward card sent to their home, and they'll be able to add dollars to that Visa reward card for every healthy action that they take. Some of those healthy actions, as an example, if they've logged into the member hub and they've created a profile, and that profile says, hey, if you take this health risk assessment, we will add X number of dollars to the reward card. If you then pick a PCP, we will add X number of dollars to a reward card. If you go out and you get your physical, we'll add dollars to your reward card. If you go get a flu shot during before flu season starts, we'll add dollars to the reward card. Keep in mind that that is 1 reward card per household, and those can change from year to year. So they could vary from time to time. They could vary from geography to geography in terms of what the members are being asked to do to accomplish to get those rewards. So those can change. Some examples that we've heard, as an example, out in Colorado, where they were asked to go out on a hike and earn a reward for taking a hike. That was something they did there. Not saying that we'll do that in North or South Carolina, but just different things like that to stay engaged with the members. Staying in front of and staying engaged with the members reminds the members who they have as their health insurance company, who's partnered with them, who we're partnered with in being partnered with them. So I think it allows us to stay in front of that member, because you do inevitably, you do have members that you do enroll that the only time that they use their insurance is if they go in for their annual physical. They're healthy, they're younger, they don't need it, they don't go 2-3 times, more than 3 or 4 times a year. They use it once or twice a year for physicals, and that's it. So if we're reminding them of these little actions that they can take, hopefully that builds up a little bit of loyalty for them, and they'll want to perhaps renew with us when their renewal comes out for the following year, because of how we treated them and some of these little add-on benefits that we provided to them throughout the year. So again, just to reiterate, make sure that you mention these things, because other than myself and the folks who work at Bright, and when the members get information in the mail from us, we want to make sure that they're educated up front to know that these are additional benefits that they're going to have access to, and they'll be able to take advantage of as they're members with us.
The other thing is that our main competitor has nothing like this, so you can differentiate yourself from that main competitor.
I want to jump into a couple of resources and tools to use. If you, I tried to put a spotlight on this a couple of weeks ago, so if you've received an email from me, you might have seen me mention our calendar for some of the webinars that our team does. But we do have a pretty robust events calendar. It is on brighthealthbroker.com. You can sort that by specific states. So if you are someone who does sell in a different market, I know this was focused specifically on North and South Carolina today, but if you are someone who sells members in another state where Bright Health is located, Florida as an example, Colorado, wherever it may be, make sure that you tap into the website to see where the events are, because not all of the events are just in-person events. There's a lot of webinars that are done in other geographies. Okay, so that I know that our folks out west, they do webinars, it looks like almost once a month, just to give you an idea, an overview of what Bright Health is doing in that geography. And as we get past open enrollment, I'll do that myself. You'll see on there today, if you haven't registered and you're still planning to come out to the Charlotte product enrollment product rollout that we're doing on Monday, you will see that listed on the calendar. Our official Charlotte rollout is Monday at 10 a.m. at Charlotte Motor Speedway. I know a lot of folks have registered for that, so hopefully you're still planning to come out to that to see us, to learn more about us in person. And you'll see the other events, as I mentioned as an example, the one for Greenville, South Carolina, and you'll see other events that'll pop up on their webinars that I'll do. You will also see corporate-based events. So we have a corporate trainer named Darren Cohen. He does provide different webinars that he does, live webinars that he does, that shows how some of the broker tools that we have work. He will sit down for, usually is no more than 15 or 20 minutes long, and walk agents through how some of the tools that we have, how those work, and how you can better utilize those tools. So as we get towards November, and as we get into November, make sure you're taking a look at that calendar to see what types of webinars he may be doing, so that you can jump on those to learn more about some of the tools that all the agents will have access to, for helping sell Bright Health, helping make payments, helping to enroll customers through the platform. You'll see all those webinars will be posted out there to get everybody up to speed on how to use the tools with Bright Health. If you are in the broker resources area, you will see the marketing collateral that we've built as well. If you do some social marketing, you'll see those listed in there. If you have things that you post on social media for Facebook, you'll see some of that information posted on there. I haven't seen our information posted specifically for North Carolina just yet. We're still in the process of getting that updated, but you will see as time goes on, all of the materials posted on the website. Very simple to use. Tell it what state you want, what material you want. It's very easy to find, very easy to navigate. You'll be able to find all those through the broker resources page. So one thing that I can tell you definitively, obviously we are new for North and South Carolina. Most of the folks on the webinar today have probably never sold a Bright Health plan in any other market. I'd be surprised if anybody on here has. honestly. But I can say that we are very proud of the fact that from the beginning with Bright Health, that we have been fully partnered with brokers in all of the markets that we have been in. It's been the practice from day one. We've always been focused on using brokers, always been focused on broker distribution. So we want to make sure that we reward those brokers by paying the commissions accurately and timely. And in all the other geographies where we launched, we have been upheld to those commitments. So we will maintain that for the folks that are going to sell us for North and South Carolina as well. So we'll be focusing on, we'll be getting the commissions out early next week for North and South Carolina. We're pretty excited about those commission rates for North and South Carolina. I think it's going to bring a lot of new agents back into the fold that are going to want to sell individual plans. And as we get closer to 11/1 here in the next 2 weeks or so, we'll also find out what type of bonus we will pay for new business sales. We don't have those specific dollar amounts yet, but in all the other geographies where Bright Health is launched, there's always been some type of bonus for the agent based on the number of members that they've sold during with us during that open enrollment period. We have a great team that we've already built that is actually a small focus group for us. We've already met with those folks in Charlotte. We handpicked a group of folks to meet with that we sit down and we will work with as time goes on to get feedback in terms of what we do, what we provide, where we're going. So we do value a lot of that feedback that we get. It helps us bring better products to the marketplace. And they really do help guide us in terms of what we're trying to bring out there to the market and bring to all the brokers that are in those markets. And again, make sure you pay attention to the calendar because you will find all that additional training that is on there, all the systems training, material training will all be focused on there. I've got some short videos that I can also send out that show how to make payments in the payment portal for the members, that how the agents can make the payments for the member, those things that we can go over. But we also will do the live webinars to show you how some of the systems work on the back end to make life easier for you to be able to sell Bright Health as well. If I can't answer questions for you for North Carolina, take a note here of who some of the other contacts are for Bright Health across the country. So for folks that are down in South Carolina, if you're in the Greenville area, in the middle of the page, Courtney Jones is the broker manager for Tennessee and South Carolina also. So you can reach out to Courtney if you have questions for that particular market. If you're doing some business in another state, you'll see the contacts there listed for those states. But by all means, if it's North Carolina, please reach out to me. I'll do my best to get back to you as soon as I can to answer questions specific to Bright Health. If we're not available, if I'm not available, somebody else in another market you've tried to reach isn't available, give our broker support team a call. They're available 9 a.m. to 7 p.m. Eastern time, 5 days a week. Those hours will likely change during open enrollment as they get busier. Right now, they're doing a lot of work in terms of contracting, but they're there to answer questions on plans as well. So if you do have some plans that you just can't reach us and you need a quick answer on, make sure that you've got those folks have your back as well. So just keep in mind, Bright Health isn't a huge organization. We're growing rapidly. So we've got a lot of folks and we're very responsive. We're able to pick up the phone. We're able to answer the questions very quickly. I don't anticipate that you'll be sitting on hold for hours and hours like we've seen with some of the competitors in the past. We'll be able to get to you pretty quickly. Yeah. So with that being said, I won't go into the marketing piece because I wanted to reserve a couple of minutes for questions because we do have a hard stop at 10 a.m. for another webinar. But I appreciate everybody's time, and hopefully this was able to give a little bit more flavor in terms of what Bright Health is trying to bring to North and South Carolina. So thanks again for everybody's time.
Mm-hmm. Thanks, Jason. One thing I'd like to add, this is Jeff Bonico. Jason and I have been part of the individual market in North Carolina for quite some time. So we are really involved in that market. We want to see it work out. We want to provide you guys with a competitive product to sell. And we want to show you that we do support brokers. We are not going to hold you hostage with your appointment. We welcome anybody to come appoint with us and get contracted. Messer Financial is a great organization to do your business through, and we're happy to be partnered with them. But thank you very much for your time today too.
Thank you, guys. And I know that we had a hard stop at 10 o'clock, so I just want to say just a few things just to recap. Please be sure to go to the local rollout meetings too. Like they were saying, there's one in Charlotte or Concord, I should say, next week. Plus, they've got the rollout meetings coming in South Carolina. Get to know them. I have personally known Jeff and Jason for quite a long time. I also worked with both of them when we worked with Coventry One. So for those of you that did individual health insurance back when Coventry One was a player, I worked with them there, and so they have a lot of experience and they know the right way to do things. Bright Health is here to stay. I'll tell you what it seems to be. Bright Health's MO is that they started local in Denver. They saw a success formula, and they were able to expand in other states, and they keep doing that. So they may only be in several counties this year, but I got to tell you, after this year, as long as they are profitable, which everything shows that they're going to be, I don't see any reason why there's not going to be huge expansion coming up. So again, guys, lots of opportunity. They pay well. This is the perfect way to earn trips. I expect everybody to be at our Top Producer Summit next year, 200 members on the books. We have quoting software. Bright Health is on our contracting site, so if you haven't done so already, please be sure to log into SuranceBay, request your appointment. Just to let everyone know, once you request that appointment in SuranceBay, there will be one additional link that's sent to you afterwards. So you want to make sure to keep an eye out for that and complete that. Make sure you do your FFM certification. For a lot of you, I know you probably haven't done it in a few years. It only takes a few hours. It is free of charge, and that's all you need to do to be ready to sell for ACA. So again, Jeff, Jason, I want to thank both of you for joining us. Let me just see if there's any questions. Jason, do you mind showing the broker manager page again? Perfect. So again, use them as contact. And I will say this too, Jeff. What was that statistics you were saying on your broker support line? Whenever they call it, what's the statistics of people actually being able to complete things on the first call?
So on the first call, there's a 97% call resolution with our BSU. We want to make sure we answer your questions when you do call in, and if they don't answer your questions, they will certainly call you back with the correct answer. But those are great stats for a broker services unit.
Yeah, 97% resolution status is incredible. So don't hesitate to use them. Call them if you need the phone number. You can always go to Bright Health's website. They can get you that information as well. One of the questions here was, can we enroll clients through Messer's enrollment tool? Absolutely, yes. I highly recommend it because, like I said, it also works as a CRM platform. So anything that you submit through there is going to be kept in your log, so you can go back later and get them. So again, huge opportunities. We want to make sure everybody has everything you need. If you need anything from Messer Financial, please don't hesitate to contact us directly, 704-568-9649. You can also go to our website, messerfinancial.com, to get other information. And again, Jeff, Jason, thank you so much for your time. Everyone out there, thank you for your time. I want to wish everybody a happy weekend. And Jeff, Jason, do you have anything you want to say for closing?
I do not. I just appreciate it. Appreciate the opportunity.
Yes, thank you for.
So everyone knows, the ACA platform will be live November 1st for Messer Financial's tools. So you'll be able to quote all the carriers for 2020, see all the rates, do all your comparisons at that time. So again, thank you everyone. Have a great weekend, and we'll see you soon. Thank you. Bye-bye.